You ready? Let's do this.
Then let's do this. All right, everyone, welcome back to the GROklahoma podcast. It's a Monday morning here, and on this podcast, we amplify the people and programs shaping the future of clinical and translational research in Oklahoma and beyond. A few episodes ago, we had the honor of speaking with Becky Manuel, a pioneer in lactation care, a breastfeeding advocate, and someone who has really helped shape maternal and infant health policy here in Oklahoma and beyond. Today, we are continuing that vital conversation by spotlighting one of her incredible collaborators. So if you recall in that episode, if you're yet to listen to it, pause this right now and go listen to that. We highlighted the importance of cross collaborations and just one of the people that have made it happen for her. And after we ended the recording, Becky had recommended our guest for today, and I followed up with her, and the rest, as I say, is history. So shout out to Becky for making this happen. So today we have the Assistant Program Director for Technical Operations at the Oklahoma Breastfeeding Resource Center. She's also a passionate public health professional with over a decade of experience in maternal and infant nutrition. She's a registered dietitian and an international board-certified lactation consultant. She has been instrumental in expanding statewide access to breastfeeding support, including through innovative tools like telehealth and the Oklahoma Breastfeeding Hotline. In this episode, we'll explore how she's bridging the gap in maternal and lactation care across Oklahoma, a journey from clinical care into research, and how she's helping make breastfeeding support more equitable, tech-enabled, and family-centered. Everyone, please join us in welcoming Jaclyn Huxford to the podcast.
Thank you so much.
Thank you. Really an honor to have you on the podcast. So like we do on this podcast, we'd like to know how and where did you grow up? And specifically, what will have predicted what you're currently doing right now, if you were to draw that from your childhood?
Yeah, so I grew up in Texas in a small town called Goldthwaite, Texas, which is in the center of the state. It's very rural. I graduated with about 38 other individuals. And living in a rural town in Texas, I did a lot of 4-H projects, and I focused on nutrition. So I did things starting from the age of 10 all the way until I graduated from high school. And that really shaped what I wanted to study when I went into college. So I got a degree in nutrition from Texas State University, which is in between Austin and San Antonio. And when I was in college, during our nutrition and the lifespan class, our professor spent 2 days covering the importance of lactation and breastfeeding. And she showed a very educational video that was, several decades old, showing how Nestle or other formula companies would go to third world countries to help the starving children and give them formula, and then they would become sicker because they didn't have adequate water supply to mix the formula, and then the mothers would stop breastfeeding, and it was this cascade of events. And her take-home message was how important breastfeeding is across the board, no matter who you are, no matter where you live, that it is a public health issue and that we need to support breastfeeding and not, turn straight to formula when that's not always the answer, that we need to help protect breastfeeding for families. And then that kind of shaped my career moving forward. I worked for the WIC program in Texas, Women, Infants, and Children program. Also in Oklahoma, I worked for them in both states. And we received tons of breastfeeding education as professionals, and then in turn gave that education back to the public. And that more paved the way for me to become a board certified lactation consultant.
Oh, wow. Thanks for sharing all of that. As you're talking about how you grew up and your pathway to school, I was like, oh, wait, I don't know Goldthwaite, because again, I used to live in Texas. I lived there for about 7 years. I actually went to Austin, so I know San Marcos very well.
Yes.
And they have a good shopping complex there.
Yes, they do.
The outlet mall, yeah. I remember after Thanksgiving, we go there for Black Friday to avoid all of the crazy stuff. And also for highlighting your formative years, especially what you're exposed to and how that has really shaped what you currently do. So it's always amazing to help our listeners really understand that whatever your path you're on right now, it could make for a great story. Just keep going. Because I bet you didn't think that all of that was going to lead you to this, right?
No.
Yeah.
And what's also interesting is, my parents have land and everyone has land where I live. So
Yeah.
I don't think much about it. And, that kind of, I think, why Oklahoma feels so at home to me coming from a rural part of Texas. And my dad's always like, well, of course, breastfeeding. How do you think the animals, we raise sheep primarily. And, if the baby lamb in the first 24 hours didn't receive the colostrum from the mother, usually died, because as you can imagine, formula for livestock, it's much different. So, there are times where we would have to help go get another sheep that may have been, nursing another baby at the time and try to get milk from that sheep to give to that baby who wasn't nursing for whatever reason. There was one time we even got a goat. So it's kind of funny. We see that in social media trends. I got to buy a goat to feed my baby. No, you don't. But in the ranching world, I see where that comes from. We would, try to help these
other animals
survive.
Yeah. Okay. So you've told us what drew you to the world of maternal and infant nutrition. What keeps you passionate about it?
Oh, I love learning. I love knowing what the trends are, what the newest research is. It's something that we've done as humans since the existence of humans. And so sometimes I feel like we overcomplicate it, but then at the same time, I feel like, that we have to support each other. And to do that, we have to know what is happening and what information are families getting, what are they not getting. Social media exists. So there's a whole, another topic, regarding that in the world of lactation. Now fast forward, I am a mother of 3. I have many friends and family that all have children. So just, using, I'm always using the knowledge that I have and the knowledge that I'm gaining daily from, learning to help families, whether it's something simple or something more complex. So that's definitely what keeps me passionate.
Whew. Thanks for sharing that. Now, what you do, I see it as it's so multi-layered, right? You're not just helping the babies thrive and all that, but you're also working with families. And take whatever you can take from that. I imagine it's not a walk in the park, because sometimes even if you're trying to maybe educate my parents, maybe a first-time mom or a first-time grandma, they will tell you, oh, this is how we've been doing it. But you're trying to bring them back to the center and say, hey, let's do it this way. What would you say are some best practices for collaborating with families, especially when, emotions are high and values are not well aligned?
Yes. And as you can imagine, so I manage the breastfeeding hotline that's been around for 15 years. So we take those calls when emotions are high. Maybe grandma's calling because her daughter is crying at 2 o'clock in the morning and the baby's crying. So, and then a lot in this profession is sometimes you just have to listen. Not jump to, okay, let's try this, is maybe get all of, maybe what they need to say out first, and then, kind of read that situation the best that you can, understanding where they're coming from, because, giving them a slew of information at 2 o'clock in the morning when everybody's crying is not beneficial, right? They're not in the capacity to hear that.
Or even sleep deprived. Yeah,
exactly. So it's kind of meeting them where they are, and a good, is let's get through this feeding. Let's get to the next feeding. Let's not, what are we going to do in a week or a day? Nope. Let's focus on right now. What are we going to do right now? And sometimes with babies, sometimes it's just skin to skin, right? I know that's not always the answer, but, especially in those first couple of days, everything's new for mom, for baby, for all the family members, and, baby won't stop crying and what's wrong. And, they're adjusting to being outside of the womb. So sometimes that skin to skin can kind of help calm everybody. And usually baby may be wrapped up in a swaddle or in clothes or, whatnot. So, but yeah, just kind of meeting that family where they are, and then, providing whatever information or education is appropriate for that time.
I love that. I love how you said meeting them where they are and then just hearing them out and see what the gaps might look like. Now, just to clarify, your center, like the hotline, supports Oklahoma, right? Oklahomans in Oklahoma.
Yes.
Do you guys have any considerations for because now Oklahoma is getting a bit more I call it cosmopolitan. We're having, more people from different cultures whose first language might not be English. Do you guys have considerations for translation services to really meet people where they are?
We do. So with the hotline, with normal phone calls, right? We utilize language line services, so we can, meet families with whatever language that that they speak, which is huge. It's not always fun to have a translator. However, sometimes that may be all we have, and we still want to help these families, right?
Yeah.
We also have texting as well. And so what's beautiful with texting is then we can use Google Translate, right? Or if they have their phone set up to where it translates automatically, we can communicate that way, which, sometimes, technology is helpful, right?
Okay. Yeah, for sure.
The texting has been huge. The most common language that we do get is Spanish. I know there's others that we have. I can't think off the top of my head what we've had recently, but I know with the texting in Spanish, we use that a lot to help families, which I think is very helpful. And we do have a bilingual IBCLC on our staff. She speaks Spanish and English, but we do utilize the services that are out there, language line, to communicate.
This is like a little bit of a random question. So Spanish, I imagine, will be like the next language that is more prevalent compared to English, right? Was there a time you guys got a caller that was from like a super random place, and you're like, oh, we need to find somebody, and you're like, oh, that's interesting? Maybe a first time caller with a different language than English or Spanish.
Yes, we had German not that long ago. I know what I'm saying. I knew there was one off the top of my head. And yeah, so we just call our, I don't know if you're familiar with Language Line. We use it in Texas. So in Tarrant County is where I was at in the WIC program, and tons of different nationalities or races and languages, all the things. Learned a lot. Like Burmese is a very, very common language. And Karen, I think is how you pronounce it. It's another very common dialect, but there's another dialect similar. Anyways, so yes, I'm very familiar with Language Line. They're a fantastic service. Anyways, yeah, so we had German recently. We also got a call. Now, granted, it wasn't a Language Line issue, but we got a call from a dad, and they were in Japan. And he was military, and so he knew of the hotline. And he called the hotline. It was actually Easter Sunday, which is just kind of just how I remember it. And so the hotline consultant who was on call that day was like, I don't know how to call this number back. And I was like, let me do some digging online. And so my cell phone carrier covered international calls. So I was like, I'll call him. It won't charge me. And anyways, I was able to chat with this dad and help this family. And it was just kind of one of those really cool stories. So
wow,
that was about a year ago. Yeah.
Interesting. All right. So when Becky, and thanks for sharing that, by the way, I'm a language buff, and I'm always very curious to hear like some random facts about languages. So thanks for sharing that. When Becky came on the podcast, she talked about the IBCLC certification. And I think one of the things I took so many things out from that episode, but one of the things that really stayed with me was how standardized the licensing was. So if you're licensed in Prague, it had portability. You could practice anywhere else in the world. And I'm like, wow, what is it done that way? And in looking more about the certification, I found out interestingly that the path, like your path from being a registered dietitian to IBCLC isn't uncommon. About 30%, I think, of those who hold that certification, they also hold additional credentials in nutrition or nursing. And I think it was the International Board of Lactation Examiners. They report that if you have those dual credentialed professionals, they often provide more comprehensive care. And that can help to address those both nutritional and breastfeeding challenges that frequently overlap. So my question for you is this: how did your training as a dietitian evolve into becoming an IBCLC?
So it's kind of funny. I feel like sometimes I did it backwards. When I graduated college, I actually didn't pursue the dietetic internship at the time, which is usually the transition of you get your degree and then you do a accredited program, which is an internship, which is it's like a year long, and you study in community nutrition, clinical nutrition, in like food service or management. So like the kitchen side, if you will. And then you take your exam and, become a dietitian. So I didn't do that. I just started working for WIC and became an IBCLC first, and was actually an IBCLC for about 6 years, and then decided to go back and do the dietetic internship. So
Nice.
On the flip side, I actually found it interesting that, not that I was displaced from nutrition, because it's all still relevant, right? Mother's milk is the first nutrition that we get. Yeah. It's, so vital to, preventing diabetes and obesity and all these, things that dietitians work with later in life. So it was fascinating for me to at that point in my career, to kind of flip gears, if you will. And it kind of just drove my love for lactation up even more, if you will, kind of seeing what kind of impact it has across the board. But what we're also seeing too, kind of, what you're saying, this dual credentialed, and that there's 30% of IBCLCs are also dietitians as well. Yeah. We actually have a program here at OBRC where we call it a Pathway 3 program to becoming a lactation consultant. So we'll get students who have just finished the dietetic internship, and they'll immediately start our program. So when they finish school, they're already, if you will, dual credentialed. They have their stuff to become the dietitian, and their hours and training to become a lactation consultant. So they can enter in the workforce, and they're ready to do whatever their heart's desire, right? They've got the training, which is a really interesting trend that we're seeing. But yeah, so I don't know. I guess I'm an odd case, and I always tell our students, I was like, I did things backwards, but I wouldn't have changed it for anything. It was neat to see kind of that flip side of the different role of nutrition later in life. So
yeah, I mean, I think it's also, and thanks for sharing that. I think it's also very encouraging to, for your trainings to see that no matter how you get started, it doesn't really matter as long as you're where you're supposed to be.
Exactly. Right? Yeah. And you're never too old to go back to school.
Oh yes, great. Because Becky also talked about that, so I'm glad to keep sharing.
Becky did the same. She got her MPH later in life, so she's a fantastic role model. Educate yourself. If you have the drive, go for it.
Go for it. And it's never too late. There's this, I'm Nigerian by birth. There's this saying in one of the tribes, the Igbo tribe, whenever you wake up is your morning, right? Mm-hmm. So don't look at someone else's timeline to determine how fast or how slow you're going in life. It's your morning whenever you wake up. All right, great.
That's right.
Yeah. So my next question from that would be, you've supported families over a decade. How would you say your understanding of breastfeeding support has changed over time?
It changes, I feel like, every day, because I feel like moms, and families, they face different challenges, right? Yeah. Especially here in Oklahoma, one of our biggest challenges is access to care. So we have maternity deserts, which is, access to maternity care, but we also have lactation deserts, so access to lactation care. And it's a very rural state. Sometimes I feel like when we live in Tulsa or Oklahoma City, we forget. And we're like, no, it's a rural state. And even in the city or, Tulsa, we still serve
down the road. Yeah.
And we serve those rural populations, right? So it's like, even in the metro, you're still going to serve those families that are going to drive far to get to those services. So that's kind of changed my perspective, if you will, on the best way to help families. It's not, they call the hotline and they have this issue, and be like, okay, well, let's get you an in-person visit. Well, maybe that's not an option. Maybe they can't drive 3 hours because they don't have a car, or they have several other children, or, whatever the case may be. They can't go see someone in person. So trying to use the best to our abilities, phone calls, texting, and now that we have the free telehealth, how can we best serve these families? Now, of course, if it's extenuating circumstances, we're going to get them medical help, right? If they need to be seen by a physician or someone in person, we're going to help them figure that out. But sometimes it is as simple as, well, let's try this, and let's have, little troubleshooting things that can be done over the phone or over a telehealth that can help give them that access to care that they maybe they didn't know existed, or they wouldn't have gotten at all. And they may have just given up on breastfeeding and, switched to formula because they didn't think they had another option.
So much to unpack there. Thanks for sharing that. And I think a way to kind of extend this conversation before my next question. So you talked a lot about some of the gaps in care, not just, healthcare, but also lactation care. And I think Oklahoma's maternal health statistics, they tell a stark story. For example, Black mothers are 2.3 times more likely to experience maternal mortality than white mothers. And then breastfeeding initiation rates vary up to like 25% points between different counties. And then given how rural our state is, which you've alluded to a few minutes ago, rural mothers face additional barriers. The average distance to an IBCLC in rural Oklahoma is over 50 miles compared to like 8 miles in urban areas. From your perspective, Jaclyn, what are the most urgent equity gaps in maternal and lactation care across Oklahoma? And how do you think your center, for example, is working to reduce those disparities in access and outcomes?
I mean, I do think it is that access to care. And then in addition to the access to care, whether it be geographical or whether it's they receive Medicaid and versus private insurance. So right now, if a board certified lactation consultant, IBCLC, they cannot bill to Medicaid. So like if a mother receives Medicaid and she wants to go see an IBCLC, maybe out like a private practice or something, she's not going to be able, she's have to pay for that out of pocket, versus being able to bill that to Medicaid. So that's one barrier right there. And then just again, the access to getting to see a lactation consultant. So one of the biggest things that we have been fighting for several years is to have telehealth, right? And not just telehealth, but free telehealth. So it doesn't matter. You don't have to have insurance. You don't have to have Medicaid, anything. Like this is a free service to any Oklahoma family that needs lactation care. And it's been a long time coming, and I feel that it can be very helpful to help reduce all those disparities just by getting, let's start, if it's a standardized practice, okay, you're pregnant, let's do a telehealth during pregnancy, just to meet with a lactation consultant to answer questions, right? And then, okay, baby's here, let's have another telehealth session and another telehealth session. It's not going to solve all the problems, but it's better than what we have right now, which is nothing. It's a starting point. Getting that education in the prenatal period, and touching base, answering questions regarding breastfeeding, and then of course having that follow-up care after baby arrives. And I think that could help. So like you mentioned, our maternal and infant mortality rates are good.
So good.
They're not good. We know that they've been that way in this state for a long time. And we all collaboratively work across several different organizations to help reduce those rates, right? And I feel like with the telehealth, this is something that could really help
bridge those gaps, because they can be where they are, which goes back to your first, when I asked you that question about how to work with families, meeting them where they are. And what's a better example of this than just meeting them where they are, where they don't have to think about having to drive away from home or leave their whatever they
You don't have to leave your house. You don't have to pay for anything. It's just, it is a free service. And they all do it from their cell phone. So we currently have telehealth operating right now. Actually, I have two today after we get off this call, which is amazing. And they just do it from their cell phone, which is, everybody has a cell phone, right? So that's really beneficial.
So Becky's work, she highlighted baby-friendly hospital initiatives. And I think from statistics, those initiatives have been shown to reduce racial disparities in exclusive breastfeeding rates at discharge, I think about 27%. And I think one moving example that she shared particularly was a rural Oklahoma hospital that saw that their exclusive breastfeeding rates among Native American mothers increased from 34% to about 67% within 2 years of those implementing those baby-friendly practices. Now, she shared how those designations help close racial disparities in breastfeeding. Are you seeing similar trends from the OBRC's hotline or telehealth data?
We are. So the hotline, like I mentioned, has been around for 15 years. And since, we're funded with, different, the health department and whatnot. We do collect, some statistics, some demographic information, not much, just enough to have a picture. And we are closing those gaps. It's not as fast as we would like, however, but we are serving, all the different populations, and sometimes it's as simple as, can I take this medication while breastfeeding, or my baby's in the NICU and I need help with pumping, or, whatever the case is, from high acuity to low acuity, we're helping those, helping to close those gaps and disparities, and just wanting to continue to close them with the expanded services that we've added to the hotline now with the telehealth.
The telehealth is the future.
It is. Well, yes. In some cases, yes, absolutely. I wouldn't say it's like sometimes when we go around to help promote this, we're not to take the place of any existing lactation consultant in person at all. This is to help, when there's no care, there's no access at all, at least families can have this, that they know they can talk with because our hotline's only staffed by board certified lactation consultants.
Right, and they're talking to real humans, like. Yeah. Okay.
A clinical expert in that field that's going to be able to help you with whatever question you have.
Yeah. Thank you. I was going to ask you a question about jumping into clinical research, but I can save that for later. But this is a good segue into telehealth expansion and, technology and accessibility. Now, I study health policy, and I think one of the good things that came out from the COVID, which I'm saying carefully because it took so many things away, by the way, the pandemic accelerated telehealth adoption dramatically. Like we had, even Biden signing a law, that's a law, Medicaid expansion, and Medicaid even allowing for use of telehealth and all that. And I think lactation telehealth visits also increased dramatically between 2020 and 2021. But of course, implementation revealed some unexpected challenges. Like in the breastfeeding space, a lot of families struggled with positioning babies for virtual consultations, while others discovered that digital support actually increased getting their partner involved in breastfeeding, support. Now, you have been instrumental in expanding the Oklahoma Breastfeeding Hotline to include telehealth and texting. Thank you for your service. What were some unexpected lessons from that process?
Oh, lots of lessons. So we're a small team here at the OBRC. Becky's been our trailblazer in the field of lactation and all things Oklahoma. She's done so much for this state in regards to lactation care. And then we have Sarah, who you met a minute ago, who's our behind the scenes person who makes everything run. So it was me and her testing a lot of things to get the texting off the ground. We want to make sure it's secure, it's HIPAA compliant, all those things. Once we got the texting off the ground, it was more of just making sure people were aware that they could text, right? Just getting the word out. As you can imagine, we're small teams, so marketing is not our forefront. It's not what we're not marketing experts. And sometimes, it's just there's too many hours in the day and I don't have time to market that we have texting now. But it's been around for 7 years now, which is amazing, 6 or 7. And I think that the word is out regarding the texting. We get a lot of text, which is great. And the telehealth, I would only say kind of our lessons learned or setbacks is, the services, it's out there, it's available, it's free to use. It's just kind of getting that word out, right? Mm. And as we know, in healthcare, I think we're still feeling some of those effects of COVID, that we're short-staffed and the turnover and all of that. So, birth hospitals are obviously one of the biggest places that we have referrals from, right? You just had a baby, you're getting discharged, here's some resources for you when you go home. And we've just seen across the board, like it's not, specific to anyone. It's just, I guess the world we're living in right now in healthcare is that there's been a lot of turnover, a lot of short staff, I feel like maybe they're overwhelmed and, they're like, well, we have the hotline. And then that's maybe where all it goes to. It's not, oh wait, yeah, they have telehealth too. I forgot all about that. And then that family leaves. And, yes, if you're Googling, what do I do in the middle of the night? How do I, you're going to find us, but how often does that happen? We do have a commercial out with a local news station promoting telehealth, but it's just really kind of, our next kind of big push is focusing, how do we better spread the word that this is an available service? Because like I said, I do have telehealth today, but with the need that's there, I would expect that we're booked out the wazoo, and that we have not seen that yet. It's been, maybe 5 a week, if we're lucky, 3 a week. So we're really wanting to get, because I know the families need the service, right? That's we have the lactation deserts and whatnot. In a perfect world, I would imagine that, you go into your provider first time when you're pregnant and they say, okay, well, we have, here's some education, here's whatever you'll go through, here's what to expect when you're pregnant. And then they're like, why don't you schedule a telehealth visit with the hotline just to ask questions, kind of like a standardized practice, right? And then same thing upon discharge, regardless of the situation. Hey, you got discharged on a Friday. I scheduled you an appointment for telehealth on Monday. If you need to reschedule it, you can. We know that we have to get baby into the pediatrician within the first 5 days, and then 2 weeks for the shots, or not the shots at 2 weeks, but you know where I'm going. They have these set appointments. Mom usually goes back for her OB follow-up at 6 weeks, right? There's nowhere in there that's ever mentioned, hey, you should see a lactation consultant. Other countries, that's standard, right? You go and you see the lactation consultant and your OB provider and, the pediatrician and all that. So our hope with telehealth is that we can somehow get into that standard of practice as far as appointments go with families that are having children, right? Just to have more support to answer those questions, whatever they may be. So I don't know, did I answer your question?
Oh yeah, no, that was that was good. I just wanted to add it. That was really, really good. Yeah. Thanks. But I think what I took out from there was just that despite the challenges, you guys keep going and you found ways to just keep tweaking it to make it better. Yeah. Now, the next question I'd like to ask you would be this. It's more of like a future expansion of it, right? So we're seeing AI now, and the intersection of AI and lactation support is rapidly evolving. There have even been some apps to really analyze, large videos to see how, like identifying common positioning issues. And there's, we have wearable breast pumps that can track data to really help with, predicting long-term breastfeeding success. And then one fascinating development that I saw while researching for your episode was AI chatbots providing 24/7 basic breastfeeding that have reduced ER visits for breastfeeding concerns by 23% in early trials. Now, as someone who's been here for a while and you've seen all the trends from phone calls to telehealth and now AI expansion, how do you see AI or digital decision support or remote monitoring transforming lactation support over the next few years? Basically, what excites you about that and what are your concerns?
So that's a very good question. And I like how you said, what excites me, what kind of, scares me, I guess would be a better way to word that. We are in process of developing an app for the hotline. Right now we're in early beta testing, if you will. And it's funny you mentioned the chat bots, because that was a question we got in the app development of if we wanted that. And we're like, no, not yet. We're going to, focus kind of on this other piece of it first. I think there's the potential for it to be extremely beneficial in the event of simple questions. Can I take Benadryl while breastfeeding? Yes, you can. Can I take this antibiotic? Yes, I can. No, you can't. Whatever the case is regarding medications. Can I exercise? All those kind of questions you don't know until you know. Can I drink alcohol while breastfeeding? Can I smoke while breastfeeding? All those questions. I think the use of AI, when used correctly, could be helpful for that. Because sometimes we still find that mothers will stop breastfeeding because they were told by a doctor that they took this medication, they had to stop, when in reality, they didn't. They were safe to continue to breastfeeding with that medication. What scares me is a trend that we're seeing. So back in May, I did a pump training regarding a breast pump training for the Coalition of Oklahoma Breastfeeding Advocates, or COBA. Did a ton of research for this topic, which was a very needed topic. Like, what do we tell families when they're wanting to pump? What pumps are out there? What research is relevant? There's wearable pumps. There's all these. I mean, just get on Amazon and look. It's extremely overwhelming regarding breast pumps. And so it really kind of, I dove into this, topic and research and what's out there. And now there's kits to measure your nipple size, and are you pumping with the right breast flange size, and is it wrong? And I'm a mother of 3. I'm a board certified lactation consultant for almost 10 years. And I was like, if I was pregnant for the first time, I would have no idea what I'm looking at. I would be so overwhelmed. It was scary. I mean, it's just, consumerism, that it's just inundated with information overload. When as humans, we've been breastfeeding since we've existed, right? It shouldn't be this difficult. We shouldn't need all these contraptions to track and monitor, and then you get on social media and, well, this mom has a week old and she's got 50 ounces of milk in her freezer, and here's one mom who can barely get to the next feeding. So it was a lot to digest, but really at the same time, it's like, well, I need to know what's out there, so when moms come to ask us questions, we know how to answer it because we've seen what's available, right? Is this a good product? Is it a bad product? So that with Chat GPT or any AI, are they going to start going to that and then getting into the nitty gritty of, you need this breast pump with this flange size, and you need to be pumping X ounces of milk per hour? It could, as a new mother, you're going to be sleep deprived. You're trying to learn how to function with an infant and all the things. And then you get into that, it could just send you over the edge. I just hope that, I follow a lot of different podcasts and platforms with lots of lactation professionals. And it's something that they've talked about on different, things. And it's just, hopefully as a profession, we can help navigate this the best we can, and just make sure that there's just good information out there. Because, social media can be a blessing or a curse when it comes to certain things, especially regarding healthcare or health, lactation care, whatever you want to call it. So that's, I just have to get off the Facebook groups, because sometimes the information flies around in there. But then at the same time, I'm like, well, if this is what families are seeing, I need to know how to best, give them information, because they did see it in this Facebook group, and is it accurate or not? So that's a great question. And I'll be, fighting the good fight with the AI. Hopefully it does for the better.
Yeah. Thanks for sharing that. And I think because I've had so many guests on the podcast with, different skill sets and expertise. And I always like to slip in the AI question, because it's just an evolving question. I'm always curious to see how different people are handling it. And your response really mirrors a lot of that from other guests. There's some excitement about it, but also that cautious optimism that end of the day, as humans, we're the final rider. We should find ways to leverage use of this technology, but also reducing the harm it might have potentially on the people we're called to serve. So thanks for echoing those concerns. I have so many questions now, so little time. Isn't that how life works sometimes?
Yes.
Now, so Becky, when she came on the podcast, she really talked about the importance of interdisciplinary teamwork. Like I said in the intro version, your name really popped up a lot. What has that been like for you, just working cross collaboratively? And what's one policy win or program improvement that you say came directly from your collaboration across, those institutions?
So I think in the lactation world, we all kind of work together in different, not just here in Oklahoma, but I think in other states as well. So every state's going to have a coalition. And so ours is COBA, Coalition of Oklahoma Breastfeeding Advocates. We work very closely with them. Sometimes I forget we're different organizations because our works coincide a lot in a positive way. Also with the Oklahoma Mother's Milk Bank, we work closely with them as well, just because we all have kind of the same mission and vision for Oklahoma families to have access, knowledge, and all the resources regarding breastfeeding. So we don't work in silos, which is great. We all kind of work together. And, again, one of our lactation consultants on the hotline, she also works at the milk bank. One of our executive director for COBA, we actually used to work together at Oklahoma WIC clinic. So, it's a beautiful thing. It's a small community, but we're a good community, and we all really support each other in our different areas of lactation. But one good, I guess you would say, policy that I can think of off the top of my head was the policies here in Oklahoma regarding breastfeeding and time for pumping for working mothers and working families. So in 2020 and 2021, they changed or, kind of improved the law to allow break time for state employees and for public school employees. Which was a huge win. And then the Pump Act, which was universal across the United States, was a huge deal. So it kind of, yes, they've always had that law, but, you have break times to pump, but there were a lot of loopholes, and the Pump Act kind of eliminated all of that. So regardless of what your occupation is, you are protected by law to have time to pump while you're at work. So that's huge. And we still get some calls, not often, I was told I couldn't pump and this, that, and the other. And we fight for them. We fight for those families. Luckily, it's not often, but it still happens. So we all work together to help support our families.
Yeah, thank you. And I noticed that even, for example, at the cancer center, they have rooms dedicated for just breastfeeding and special spaces like that. And I think that's really nice to have, because again, if you think about just lifespan of an individual, whatever happens around birth and post-birth really shapes that child's trajectory as a contributing, productive member of society. So if we can get it right by, enacting baby-friendly policies, that can go a long way to really protect and help nurture the future of our country.
Absolutely.
Yeah. All right. Now, let's talk about research. So you've done a lot, and even moving into clinical and transitional research, I imagine that's not been a walk in the park. So what would you say has been your experience so far stepping into this world, and what excites or surprises you the most?
I think just constantly finding better ways to serve our families here in Oklahoma is probably what excites me the most. When texting came about, like I said, 6-7 years ago, it was huge. And when I would tell people outside of, what I work in, just, different people that I would come across. And I remember one mom, she was a mom, she said, texting is fantastic because then you have a paper trail of whatever you say. So if you forget what the lactation consultant said, you can go back in your text thread and read what they said again. I'm like, well, duh. I never thought of it that way. Also with the texting, we can send YouTube videos, educational YouTube videos regarding like hand expression. So we have a go-to one in the lactation world by Dr. Jane Morton out of Stanford University. And we can send that direct YouTube link. And I know I can't show you over the phone hand expression, but this is a really good video, and we can send that directly through text message, which is huge. And then like my friend said, it's there in her phone and her text thread, and it's there forever, so she can go back and read it. So with a phone call, which are great, you may forget everything that they said. And which the beauty with the texting is when we do phone calls at 2:00 in the morning with families, we follow up with them the next day with a text and say, hey, we spoke last night. I wanted to check in. This is what we talked about, because no one's going to remember what you said at 2:00 in the morning. So that's what excites me, is just kind of finding, these different ways to better connect with our families. And challenges, kind of like I mentioned, just, getting that word out. We've been so grateful that we've received several huge grants in the last year, one with TSET, a TSET Discovery grant, and then we got the Choosing Childbirth grant with OSDH, which is amazing. And so it's given us, the funds we have a commercial out. We had one, and then we kind of made it longer, if you will, to add the telehealth in there. We were able to do the app, so we can meet the families there with the app. But then, of course, the challenges come with that is all the logistics that go into that, making sure it's HIPAA compliant and safe and all those things, which, we know that that's needed. It's just when you have to stop and think about, okay, we have to make sure we check all the boxes to make sure we have a good, solid platform to communicate with our families.
Yeah. Thank you. Thank you. As we're winding down, I had some, follow-up question. We know that partner support is the strongest predictor of breastfeeding success, right? And that's stronger than hospital practices, socioeconomic status, or even previous experience. Like mothers who have been highly supported by their partners are more likely to reach their breastfeeding goals. Yet most breastfeeding resources are still designed primarily for mothers rather than the whole family unit. What's your favorite go-to resource to share with new or expectant dads as a way of closing that gap of information sharing?
So my current favorite is we have a breastfeeding education for families on our website. It's free. It's also in Spanish. And it is designed just to give basic information regarding breastfeeding. It's not necessarily tailored toward the person who's pregnant, right? It's, kind of these are the benefits and these are things to expect in the first week of life with the baby. It's got, some good videos and all that. My newest favorite, if you will, that is coming is COBA is actually doing some educational series, educational video series for dads.
Nice.
Breastfeeding educational toolkit, and it's going to be videos for dads, how to best support their family who's breastfeeding. So I'm very excited for that. That's with this Choosing Childbirth grant that we got. Like I said, we work really closely with COBA. So they're in the works. I think they actually have all the stuff set up and they're about to start filming these videos. We're so excited. And then they're, of course, going to be free to the public. And they're also going to be on our app that we're developing. They're going to be in there. So just kind of really giving better and more resources for everyone that's involved in that breastfeeding process. Because it's not just the mom and baby, it's the whole family, the whole village, right?
Yeah.
Like you said, the support is very crucial to success.
Thanks. So rapid fire questions. In the next 5-10 years, what do you think is going to be different about what you currently do right now?
So I hope that we have Monday through Friday, maybe 7 days a week, telehealth available to Oklahomans. That is my goal. And we have a team of 4 or 5 lactation consultants, and that's all they do is they just do telehealth. I say that, they do other things, but that would be kind of their go-to. That would be huge. And then just having more of that standardized kind of, scheduling with all the education. So you're pregnant, you get a telehealth visit and you do our free online education, kind of that wraparound services regarding lactation.
Okay.
That's my goal.
That's a good one. And what's your favorite thing about living in Oklahoma so far?
Oh, I love everything about living in Oklahoma. I just came back from Italy and it was wonderful, but man, I do love it here. Edmond is home and I'm not even from here.
Right.
But I love everything about Oklahoma. The people, I think it's the people.
I agree.
I mean, it's cliche to say, but the Oklahoma standard is real. It really is.
It is. It's like even sports. You kind of it's like, oh, how do I survive outside of here? Right?
Yeah, no, it is wonderful. It just feels like home. I don't know how else to put it, but it is home. And I'm really upset that I missed the Thunder Parade.
Oh. You can always watch the reruns.
I know. I'm so proud.
So, last question will be this. Before you leave, we usually have guests leave questions for the next guest. They don't know who they are, So I have about 9 questions because I've had multiple guests with, multiple people at different sessions. Can you choose a number from 1 to 9?
7.
7. Cool. This is from Ashley coming forward. What brings you the most joy in the work you do?
Oh, it's the stories from the hotline. One recently, I met with a mom via telehealth during pregnancy. She was very high risk. We talked about a lot of, possibilities and situations. Baby was born and we communicated via text and on the hotline. And I said, skin to skin, skin to skin, skin to skin. And she told me later that because she kept doing skin to skin, that she kept her baby out of the NICU and was able to be discharged within 2 days, and was the best case scenario in a very scary situation because she was very high risk and was convinced she was going to have baby very early and NICU stay, all the things. And she didn't. Everybody was happy and healthy and went home, and they still do skin to skin. I think he's 6 months old now. So
Nice.
it was those anything like that. They just, and not just that it's me, any story I hear from the hotline, because our team is amazing. That's what gives me the most joy, is those little things of little pieces of little nuggets of knowledge that go such a long way.
And that's something as simple as that, but then the impact it has. Thanks for sharing that. So for you, as a gift to the next guest, what question would you like to leave behind?
Do you know what the Oklahoma Breastfeeding Hotline is?
Ooh. If you don't, then I'm going to send them to your...
Yeah.
Okay. What's your number, by the way? The Oklahoma Breastfeeding Hotline number.
You would? I know, but I know our texting by heart. I have it on my homepage.
Okay.
Hold on.
Okay.
It is... Nope, that's not. Yeah, that's it. Okay. So it's 1-877 271 milk.
271 milk. Okay.
271 milk. And then to text, you text OK2BF to the number 61222.
61222.
And the telephone number is 24 hours a day, 7 days a week, but we don't take holidays. The texting is also 365 days a year, but we do only text during like 7 a.m. to 7 p.m. So if you text that at 2 o'clock in the morning, it will actually tell you, hey, you should call and wake someone up.
Wow. That's really comforting to know that all around the clock, you're always there.
Yes.
Thank you. Thank you so much. Unlike your hotline, we're not going to keep you around the clock today. It's been such an amazing time with you on the podcast. Thanks for just sharing a lot about who you are and about your work, how you guys have done a lot of work expanding the breastfeeding hotline to integrating telehealth and advocating for equitable, compassionate lactation care. And thank you for your work in helping us to imagine what support for family can look like, especially in tender moments that matter most. And you've also reminded us, the importance of building systems that are responsive, inclusive, grounded in both evidence and empathy. And it's clear that your work, alongside what Becky shared with us, is creating a ripple effect across Oklahoma's maternal infant health landscape, but also it's going to have a lot of net positive for the future, because these are children that will grow up to be future leaders and future workers. And to our listeners today, if today's episode inspired you, we encourage you to share it and check out our earlier episode with Becky Manuel to hear the full arc of this work in motion. So whether you're a researcher, someone who's starting out late in life, a provider, a policymaker, or a parent, a dad, mom, or someone in between just supporting villages or children and families, there's something here for all of us about how small shifts can lead to systemic changes. Until next time, stay curious, stay committed, and keep growing with us right here on the GROklahoma podcast. And thank you so much, Jaclyn. It was nice having you on the podcast.
Thank you for having me.
And I hope you enjoy the rest of the day. Many thanks to Sarah for her support.
Yes.
All right, then. Bye.
Bye.